Hello everyone, this is our final presentation for the class Pharmacology of Daily Life. I am Cai Zicheng from the Life Science Department, and my group member is Laya Chen from the English Department. Today we're going to talk about osimertinib, a treatment for lung cancer. The first part, we're going to introduce what is osimertinib and how we use it and why we use it. And the second part, we'll introduce different types of lung cancers. And for the third part, we'll talk about our motivation of why we chose osimertinib as our topic. Let me begin by explaining what is osimertinib. Osimertinib is a medication used to treat non-small cell lung cancer with specific mutations, sold under the brand name Tegrisol, and its generic name known as osimertinib. It was approved for medical use in the US in November 2015, and the year after in the European Union. Its route of administration is by tablets taken through the mouth. And then we're going to talk about the therapeutic use of osimertinib. It's a EGFR tyrosine kinase inhibitor as a treatment of non-small cell lung cancer, NSCLC, which we're going to introduce afterwards. Let me explain what is EGFR. EGFR stands for epidermal growth factor receptor, and as the name suggests, it's a kind of transmembrane protein that is a receptor for members of epidermal growth factor. EGFR was discovered to be an oncogene, which led the development of anti-cancer therapeutic directed against it, such as osimertinib and other generations EGFR tyrosine kinase inhibitor. So why do we use osimertinib as the treatment of NSCLC? It's mainly because the drug tolerance of gefitinib, erlotinib, and afatinib. And this situation occurs when the cancer cells are positive for the T790M mutation in the gene code of EGFR. The T790M mutation may be new to the first line treatment with EGFR tyrosine kinase inhibitors except osimertinib, which is the third generation EGFR tyrosine kinase inhibitor.
Okay, so after hearing the therapeutic effect of osimertinib and why we use osimertinib, now we are going to talk about its side effects. As you can see here, most people may want to sleep or have sore body after taking this medicine. Besides, having inflammation reaction around your nails, rash on your skin, diarrhea, or constant coughing are all common side effects of osimertinib. However, some patients may face serious problems in their eyes, lungs, or even heart. Thus, before taking osimertinib, please make sure that your medical condition is suitable to take it. And the second part, do you still remember that we have mentioned an abbreviation of a certain disease, which is NSCLC? I'm afraid that most students aside from medicine department wouldn't know what that is, so I'm going to briefly introduce it. Okay, so first of all, lung cancer can be divided into two parts. The first one is SCLC, which stands for small cell lung carcinoma. This type remains only 10 to 15% of lung cancer, and it is highly related to smoking and usually appears on larger bronchus. Small cell lung cancer grows and spreads fast in human body. 70% of patients' tumors has already spread to other body parts before they were diagnosed with this disease, and 60% of patients would die within 1 year. Sounds horrible, right? Yet, the good news is that SCLC reacts sensitive to chemotherapy and radiation therapy. And here, this is the second type of lung cancer, which is an SCLC, non-small cell lung cancer. NSCLC occupies 85% of lung cancer. It arises from the epithelial cell of the lung of the central bronchi of terminal alveoli. This kind of lung cancer grows and spreads slower than SCLC, and it can be divided into three main categories. which are adenocarcinoma and squamous cell carcinoma and large cell carcinoma. Adenocarcinoma is the most common type. The proportion of it is 50% of non-small cell lung cancer. If you heard someone that she's a female and she never smoked, yet she still got lung cancer, it is likely that she suffers from adenocarcinoma. This kind of cancer starts in the mucus-making gland cells in the lining of your airways. Next, squamous cell cancer. This type develops in the flat cells that covers the surface of your airways. It tends to grow near the center of the lung. The last one, large cell carcinoma. The cancer cells appears larger than a typical cell under the microscope. Previously, I mentioned that someone who doesn't smoke is still likely to be diagnosed with lung cancer. So, what kind of people are at a higher risk of getting lung cancer? Needless to say, people who use tobacco in the long term, also people around tobacco users, since they are exposed to secondhand smoke lengthy. Besides, people who have radiation therapy to breast or chest, live in an area with severe air pollution, and are infected by HIV are likely to get lung cancer too. Last but not least, those who have a family history of lung cancer are definitely at a higher potential risk of having lung cancer. But if you get lung cancer, don't panic. Now, we have osimertinib. The survival rate of lung cancer now is much more higher than before. Here's a short video clip I found on YouTube that I want to share with you. It's about a lady who never smokes, yet still being diagnosed with lung cancer, and she's under the treatment and taking osimertinib.
74-year-old Linda Wernickoff never smoked, but after months of a chronic cough, her doctor had unexpected and unwelcome news.
I told her, I'm a straight shooter, tell me what you think. And she said, I do think it's cancer.
Linda was diagnosed with stage 3A lung cancer. She had surgery followed by chemo, but wasn't sure what else could beat back the disease. Dr. Timothy Burns is an oncologist and a lung cancer researcher at UPMC in Pittsburgh. His passion for fighting lung cancer started early. He was only 7 when he lost his dad to lung cancer. His mother died from the same disease when Burns was 16.
I think now of where we've come, and I can almost guarantee you that they would have lived longer today than they did then.
Dr. Burns was following the clinical trial for the drug Osimertinib, designed to prevent recurrence in lung cancer patients with the EGFR mutation. The drug was so effective, the trial was halted early to allow all patients access to the treatment.
Overall, you saw in all patients about an 80% reduction in your chance of your cancer coming back.
Dr. Burns called the drug practice-changing and prescribed Osimertinib, which also goes by the brand name Tagrisso, to Linda.
It just sounded wonderful, especially for my particular stage.
One more treatment to keep the cancer from coming back. I'm Marty Salt reporting.
So, after watching this video and hearing our presentation, I believe all of you have a basic knowledge of osimertinib. So, back to our title. What is osimertinib? Originally, my team member and I couldn't decide which topic to choose from. But while we were having a discussion about our presentation on telephone one day, he just kept coughing that he couldn't stop. And I'm sure that coughing is the symptom of lung cancer. And I just joked that he will definitely die from lung cancer someday if he doesn't quit smoking as soon as possible. And that's why we're interested in lung cancer and started to find which kind of medicine could effectively treat it. According to the statistics from WHO, lung cancer is the top 1 death rate cancer all over the world. 1,800,000 people die from it every year. And we do hope the medicine osimertinib, which we introduced today, could save more patients' lives who suffer from lung cancer. And this is the end of our presentation today. Here's our references. And thank you for listening today.